Good afternoon, everyone. So, by the time we all know there are many techniques to assess this lumbar degenerative fusion and stabilization, like posterior transforaminal, extreme lateral, oblique lateral, and anterior lateral interbody fusion. But out of these, when we point a single technique still the OLIF and MIS TLIF remains the most popular one. So my friends Dr. Srinidhi and Dr. Sharvin had given excellent talk about MIS TLIF and OLIF surgeries. So I am here to, I will be talking about the comparison between these two procedures in the treatment of degenerative lumbar pathology. So the aim of our study was to compare the radiological and functional outcomes of oblique lumbar interbody fusion versus transforaminal lumbar interbody fusion in the surgery for degenerative lumbar pathology. So these are two radiographic images showing what we routinely do in our hospital. The first one being the MIS TLIF, and the second one is the OLIF procedure. So all the patients undergoing lumbar interbody fusion for degenerative pathology between March 2018 to August 2021 were included in the study. And finally, 46 OLIF and 156 MIS TLIF patients with more than 1 year of follow-up were only included in the final analysis. So while comparing the demographic variables, we didn't show any statistical difference in age, sex, and BMI and related comorbidities. So comparing the functional outcomes in terms of VAS, both the group TLIF and OLIF group have shown significant improvement in statistically significant improvement without any difference after 1 month, 3 months, 6 months, and follow-up after 1 year. Similar results shown with the ODI scores also. So, and perioperative variables like hospital stay, duration of surgeries, and blood loss were also didn't show any statistical difference between the two groups. However, the return to work, which is in months, have shown the statistically significant improvement in the OLIF group of patient, which is with the p-value of 0.002. So, while we come to the correction in spinopelvic balance or colonal and sagittal imbalance, OLIF cases were better coronally corrected. So this is one intraoperative fluoroscopy images showing the correction of coronal imbalance with the 3-level OLIF. So the mean correction in scoliosis was 12 degrees in OLIF as compared to 4 degrees in MIS TLIF, which is again statistically significant with a p-value of 0.01. And again, the OLIF group showed a better correction in sagittal imbalance. You can see the lumbar lordosis in the first radiograph, which is 13.6 that has post-operative minus 24.1, and the TLIF group which is 14.5 and has a post-op correction up to minus 14.5 degrees. So here we found a significant difference in both TLIF and OLIF group when we compared the mean correction of pelvic mean correction between PILL mismatch, and we found that OLIF group has the better correction in the PILL mismatch, which is again significantly statistically significant. So coming to the discussion, as we all know, degenerative changes in the lumbar disc that has started with the loss of disc height, and then PLL buckling, then again the ligamentum flavum hypertrophy and facetal hypertrophy and canal stenosis. So these are the set of changes that results into complex set of deformity and multiple level deformity causes of loss of sagittal and coronal alignment, leading to a mechanical compromise. So as we have showed in our results, OLIF allows better restoration of disc height, correction of scoliosis, and restoration of lordosis, and along with the indirect decompression. So all these are possible because of this big size of OLIF cages, which is proving to be sledgehammer in this OLIF technique. So this is one case with pre-operative and post-operative X-ray images showing the coronal and sagittal correction with the one level OLIF. Not only this is the same patient's MRI pre-operative and post-operative after 1 year only, and showing the decent amount of canal decompression with the single level restoring the disc height. So coming to the literature, this is the one systematic review of meta-analysis presented in published in AO Spine Journal, which is also suggests the OLIF outcome significant improvements in the spinopelvic parameters. So most of the literature is based upon the comparing OLIF data and TLIF data from different study groups. None of them have like a single center study. So we have given our single center, single surgeon study with the doing both MIS, TLIF and OLIF. So we have concluded that both OLIF and MIS, TLIF can result in significant improvement in VAS and ODI scores when it comes to functional scoring after lumbar interbody fusion. But OLIF surgery results in better correction of sagittal and coronal imbalance and faster return to work compared to MIS, TLIF. So if ever thought indirect decompression is a myth, this is a slide. This is a pre-operative MRI where we have done 2-level OLIF, and this is the 2-year follow-up and showing the decent decompression with the procedure. Thank you for patient listening.